Hello friend, welcome to the channel Pharmacy Dictionary. Recently we have studied about different route of drug administration, and under the route of drug administration we have already studied about the transdermal route of drug administration. So you can see the diagram of transdermal patches. Transdermal patches means a patches containing drug that release the drug across the skin, that is called transdermal patches because it is going to apply over the skin. So in this video we are going to study about the different parts of transdermal patches along with the process of release of drug from that particular patches. In this section of whiteboard we are going to study about the parts only. Then after that we will go for the different purpose and their function. In this diagram, as you can see, this is the main part. This is called drug reservoir. Drug reservoir means a place where drug is to be kept for the release so that the drug can cross the skin and produce a desirable effect at a particular or restricted part of the skin. Now second part is outer covering. This outer covering is used to stop the release of drug backflow, actually we can say, so that it will not allow the drug to release from the backside. That will release the drug only as per its proper route of elimination, or we can say route of release. So this is drug. The drug, which is a chemical agent which is used for any purpose like solving any problem or like treatment of any lesion. So that drug will release from this matrix after some time after application of these patches over the skin. Now we have to see different layers of this transdermal patches. The first layer beneath this drug reservoir is called porous membrane. That means a membrane which is having pores. So this pores allows the movement or release of drug from the drug reservoir towards the skin side. And just beneath this porous membrane there is the adhesive. Adhesive means that will help to stick that patches towards the skin, so that will be stick on the particular part of the skin and that will not be removed from the skin. The next and last part is a sticker. This sticker is a thin layer of film that has to be removed prior to the use of patches, so that the porous membrane will allow the release of drug from drug matrix and that drug will reach to the part of the skin where you have applied. This is the basic parts of the transdermal patches. Now this drug will start releasing. The drug will start diffusing. What is the meaning of diffusion? Diffusion is a process of movement of molecule from higher concentration towards the lower concentration. So in this diagram, as you can see, in the drug reservoir the concentration of drug is higher as compared to skin at which the patches is applied. So the drug will release from this higher concentration from the reservoir towards the low concentration of that affected skin. That is simply known as the diffusion of drug. So this was a simple explanation of parts. Now we have to see different function, or we can say different arrangement of these transdermal patches with the help of a simple animation video. Now this is the drug reservoir. As I have explained you earlier, this drug reservoir is used to keep the drug with itself. It may be any kind of drug like Benadonna in case of mumps, or any other disinfectant as in case of Hansaplast. The next one is drug. The drug is an agent which is used for the treatment or cure of any particular problem. If we are applying this drug over the skin, that may be a simple lesion or burn or any other rashes, so that we can apply this transdermal patches and the drug will release from drug reservoir. So the drug will go to the reservoir side and that will be binded with the reservoir. Whenever there will be a sticking purpose, the drug will start releasing towards the skin side. So the drug is fixed on the drug reservoir, and to maintain the drug in the reservoir we need a seizing effect from the back side. So the back layer of the drug reservoir is called outer covering. This outer covering will protect the drug release from backside. It will prevent the backflow of drug. The next part is first layer, that's called porous membrane, as I have told you earlier. This porous membrane is fixed with a adhesive. That adhesive will go to the skin surface and that will allow the drug matrix or drug patches to stick over the skin, so that in case of movement that patches will not be removed and that will stick on this on place. Now next part is sticky layer that has to be removed prior to the administration or prior to the application of transdermal patches over the skin. This is just like a sticker film only. So these are three layers of transdermal patches. Whenever we apply the transdermal patches, the drug from the reservoir will start to diffuse out. As you can see in this diagram, the drug is releasing from its reservoir toward the site of of application or local site, that is skin. So this skin will be treated with the help of that particular drug for which you have applied this transdermal patches. Now this is called diffusion across the porous membrane, and that drug will produce its desirable effect for which it is intended. We have studied about different route of drug administration. We have also studied about the transdermal patches. Now it's time to utilize that knowledge for the understanding of drug with their respective example, which are used as a form of transdermal patches with their respective indication. As you can see in this table, we have divided the table into two parts. The first section is for the drug and the second one is for their indication or their therapeutic utilization. Under the drug, first drug is nicotine. You have seen the nicotine, you have seen the use of nicotine in the form of smoking or just for shaving purpose. Nicotine is basically central nervous system stimulant, but in case of particular person wanted to stop the smoking, then he or she should nicotine transdermal patches that is used for cessation of smoking. So to stop smoking, that particular person need to be used nicotine transdermal patches. The next class is fentanyl. This fentanyl is used for the relief of pain, specifically the chronic one. Coming to the next one, that is a combination of fentanyl plus buprenorphine. This is used for the relief of pain, and that particular pain which is obtained from the post-operative procedure. That means after operation, the pain can be reduced by utilization of fentanyl plus buprenorphine transdermal patches. Next one is estrogen. This estrogen is used for the maintenance of postmenopausal symptom, and that can be used as a transdermal patches. Next one, estrogen plus norgestrel. This is used for the hormonal replacement therapy as well as for the contraception point of view. So anyone who is willing to get contraceptive effect, she should use estrogen plus norgestrel transdermal patches as per the guidance of medical practitioners. The next one is testosterone. This is male sex hormone which is used for the hypogonadism and hormonal replacement therapy in male. The next one, nitroglycerin. This is one of the important drug which is used for the treatment of angina pectoris. Angina pain is characterized by left side chest pain which is due to the lack of oxygen supply, and that is just because of the plaque formation, or we can say the formation of blood clot, atheroma or spasm of coronary artery, and that can be managed with the help of nitroglycerin. The next one is clonidine, that is used for the hypertension management. Next one is scopolamine, that is used for the travel sickness reduction. Next one, seleginine, this is used as an antidepressant. So if any person is having depression, so that treatment of that particular depression condition, she or he should use seleginine transdermal patches after the consultation of the physician. The last one for this lecture is lidocaine or terracaine, that is example of local anesthetic and which is used for the relief of local dermal analgesic condition or particular anesthesia effect in particular part. So friend, that's all for today. Thank you very much for watching this video. Hope such kind of animation is improving your basic knowledge. If yes, then please do comment in comment box so that we can understand your queries and we will make more video like this. Thank you very much again. Please do take care of yourself. Thank you.